Hi, Stephanie. I'm reporting on Justin Campbell in room 301. Mr. Campbell is a 50-year-old male who was admitted on April 5th. This is his second day in the hospital. He was sent by his doctor to the hospital with right upper quadrant pain for 3 days. The patient was diagnosed with hepatitis A on April 4th. Mr. Campbell is a full code. He is allergic to bananas. He has had a previous medical history of hepatitis C and was treated for it. Mr. Campbell stated he had right upper quadrant pain of a 6 out of 10 on the pain scale on admission. The patient stated during the 3 days before going to the doctor he felt very nauseous and vomited a few times and couldn't keep enough food down. Patient stated he went to a seafood restaurant with his wife and ate shellfish. The next day he stated he woke with severe pain in his upper abdomen. The patient stated he thought it was a stomach bug, and 3 days later he went to the doctor, but he was sent here to be admitted. Patient's labs were also done. His AST was 200 on admission, ALP 200, and ALT 100. So that was AST 200, ALP 200, and ALT 100. The patient's BUN was 28, probably due to him being dehydrated. His bilirubin was 4. His hepatitis A, and there was also hepatitis A virus antibodies that were found in his blood test. The patient has had jaundice on his sclera in both eyes and upper extremities. The patient has had dry and tinted skin, probably due to the dehydration, and the patient has been ANO times 4. Mr. Campbell appears anxious, sad, and restless. His grip strength is weak, and due to the prolonged bed rest, his gait has been unsteady and weak. Patient has had non-pitting and slightly swollen lower extremities. TED-thigh hose and SCDs have been implemented to prevent DVT. The patient has limited range of motion in the lower extremities due to prolonged bed rest. The patient's last BMI was April 3rd, and he described it as a clay colored. The patient's bowel sounds have been hypoactive times 4. The patient's abdomen was firm, tender, and he showed guarding as well. The patient's urine has been a dark color. Patient has had a fall risk of 6, and there are standard precautions in place. However, the doctor has also ordered enteric precautions as well, which are special precautions taken with fecal and bodily fluids to prevent cross-contamination of the hepatitis A. So just please be careful of that. Careful hand washing has also been educated, and no visitors with active infections are allowed in. I took Mr. Campbell's vital signs 30 minutes ago, and they were temperature 98.2, pulse 89, respiration 16, and blood pressure of 115/76, and also O2 stat of 96, and his pain was a 4 out of 10 on the pain scale. The patient is on one medication so that the liver can heal. He is on an antiemetic to help with nausea and vomiting. I last medicated the patient at 1600, 30 minutes before his meal with metoclopramide, 10 milligrams, which is an antiemetic, like I said before. Patient has had limited activity because of the encouraging the bed rest for the liver, but the patient has been using the incentive spirometer every 1 to 2 hours, and the patient has been encouraged to rest, like I said before, to promote that healing of the liver, and active range of motion has been implemented every 2 hours, and the patient is tolerating this well. The patient is also working, of course, with OT and PT to increase strength and mobility due to the severe fatigue he has been feeling. The patient also has fall precautions in place. The patient has been ordered a high-calorie, high-carb diet with small, frequent meals and high-calorie snacks. The patient stated he has lost 3 pounds from the onset of the symptoms. Daily weights have also been taken. The patient is working closely with nutrition to ensure adequate diet to promote healing and maintain healthy weight. The patient has been increasing tolerance to the diet and hasn't had any episodes of vomiting since admission. The patient states frequently that he has no energy, and the adequate nutrition can help with this. So please work closely with dietary as well. The patient's wife has been visiting frequently to help, and like I said before, due to the patient's extreme fatigue, it's been hard with him with his ADLs and with walking, so he's needed assistance with both of those things. So OT and PT are working closely with him to help increase his strength and mobility. The patient has a confirmed diagnosis of hepatitis A. My concern with this patient is a few things. I'm concerned with the patient's nutrition because his nutrition is less than his body requirements. I'm concerned with the patient receiving adequate vitamins and also his hydration status to prevent dehydration. I'm also concerned with the patient's decreased mobility because of the rest that we promote for hepatitis A. I'm concerned that he's going to have too much bed rest, which will decrease his mobility. The patient has been extremely tired, which has affected his desire to move around and to also want to eat. I'm also concerned about the patient regaining his strength. And so we want to work really closely with physical therapy to help with that. Rest is very important to promote healing. However, we need to have him up and moving to promote strength and mobility, to decrease his DVTs, and to increase his lung expansion to help with breathing. In addition, I'm also concerned about the patient's knowledge of how to prevent the spread of hepatitis A. I haven't educated him on that yet. I recommend that you continue to monitor the patient and promote rest. However, I recommend you encourage the patient to get up and walk with assistance and teach him the complications of prolonged bed rest so that he can be aware of that, and maybe that will give him more of a desire to want to get up and get moving. I also recommend that you continue to encourage and educate the patient about eating high-calorie and high-carb diets with small, frequent meals to promote healing and a healthy weight. I encourage you to continue to help the patient use his incentive spirometer every 1 to 2 hours. In addition, I recommend that you teach the patient the importance of adequate hydration and all the benefits of that. I encourage you to increase the patient's fluids, and because Mr. Campbell has been showing signs of dehydration. So like I said, we really want to push those fluids and make sure he's drinking enough. And continue to assess the patient's lung and bowel sounds for any complications. Continue to use the DVT and TED hose to prevent the DVTs. And continue to give Mr. Campbell the antiemetic to prevent any more nausea and vomiting. And also please be assessing his psychosocial, because this is a very scary and traumatic time. And with thorough education, I think it can decrease his anxiety. So please just educate him on the transmission of hepatitis A, and to understand that it is transmitted from fecal oral contact. So he needs to be educated on how to be aware of that when he is going out to eat, and so that he won't be able to get it again, and to just be able to be aware of not drinking contaminated water and contaminated food, and educating him on the importance of that, and how to properly wash his hands, and how to prevent the spread of transmitting it to anyone else, and the importance of that. And also just continue to educate him on his disease and the prognosis of this disease, and to continue to allow him to ask questions. And yeah. So do you have any questions? Okay, thank you.